Hi, my name is Rachel Carmichael, and I'm going to be doing an assessment of the neuro system. So first I would start by washing my hands and introducing myself to the patient. Hi, my name is Rachel, and I'm a nurse practitioner student who's going to be performing your assessment today. Can you tell me your name?
I'm Anna.
Anna, nice to meet you. So first I'm going to start by just assessing the sensation in your face. And so go ahead and close your eyes for me and let me know when I'm touching you, okay?
No. 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 No.
Okay, great. So Anna has normal sensation of her face. We're going to move on to our cranial nerve assessment. And so cranial nerve 1, assessing Anna's smell. And so Anna, what I'm going to have you do is close one nostril and then close the other with your eyes closed, and differentiate between the different smells that I'll have you smell. Okay? So go ahead and close your eyes, and then go ahead and smell that for me.
Vanilla.
Okay, awesome. And then other nostril, smell that for me.
Cinnamon.
Okay, awesome. So Anna was able to delineate between the two smells, which is a normal finding, and identify them correctly. And so now we're going to move on to cranial nerve number 2. And what I'm going to do for that is just assess your peripheral vision. And so go ahead and tell me when you can see my fingers come into your line of vision. Okay?
No. 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 No.
Okay, and then for purposes of this exam, I will not be using a Snellen eye chart, but in the clinical practice, I would to be able to assess the patient's vision. And so what I'm going to do now is just look in your eyes, Anna, and so bear with me. It's a little bit of a bright light, but just to see the back of them, okay? Okay, so I see the red reflex. I see the retinal background, which is pink. Veins and arteries don't look constricted. And then I see the optic disc, and it's well delineated, not blurry. Okay, so I'm going to look on your other eye now. Okay, so again, see the red reflex. I see the veins and arteries don't look constricted. I see the optic disc. And again, there's no blurriness to it. It's well delineated. All right. Thank you, Anna. So eyes appear to be normal. I don't see any problems there. And so now I'm going to assess cranial nerves 3, 4, and 6. And so for that, I'm going to have you follow my finger and do just the 6 points for you to test for any nystagmus, okay? I'm going to have you just follow, yep, don't move your face. Okay, awesome. And I didn't notice any nystagmus there whatsoever. And so now what I'm going to do is just test accommodation. And so I want you to focus on this finger here, and then this finger here. Yeah, and Anna is able to accommodate and able to differentiate between the two. And so now what we'll do is we'll move on to cranial nerve number 5. And so for that, what I'm going to have you do is just push down on your jaw on my hand with resistance, and then move it side to side, okay? So push down, and then push against me. Yeah? And then I'm going to have you close your eyes and just get you to tell the difference between sharp and dull. So this is dull, and then this is sharp. Okay? All right?
Dull. Sharp. Dull. Dull. Sharp. Dull.
All right. Awesome. So Anna was able to determine the difference of sensation correctly. So that's a normal finding. So what we're going to do is move on now to cranial nerve 7. And so for that one, what I'm going to have you do is squint your eyes and then wrinkle your forehead and then show me your teeth, clench your jaw. Good. And then I want you to blow out your cheeks like a pufferfish, and I want you to extend your neck. Good. Okay, so I noted symmetry throughout, which is a normal finding. Didn't see any deviations from normal. So now what I'm going to do is move on and assess cranial nerve 8. And so for that one, basically hearing test. So I'm going to have you cover one ear, and then I'm going to whisper something to you, and you just repeat it back. This is also assessing cranial nerve number 12, just to also assess your enunciation and your speech. And so
3, 7, 5.
awesome.
Cat-like, right?
Yep, exactly. All right, so now what we're going to do, and Anna was able to answer, to repeat back the words that I said to her correctly, and so her hearing is intact. So what I'm also going to do, so if I noticed any problems with Anna's ability to hear, had any question, I could do a Weber and Rhine test to test sensory neural and air and bone conduction. But I do not see any problems with her hearing, and so I will not test that at this time. But if I had any questions, I would. So then moving on to now assessing cranial nerves 10 and 11. Or sorry, cranial nerve 9 and 10. What I'm going to do is just look inside your mouth. And again, for cranial nerves 9 and 10, I'm going to look inside your mouth. Have you open up your mouth for me? I'm just going to use this light just so I can see. Okay, open your mouth up. Okay. And I notice inside your mouth too, the tongue does not appear to have any abnormalities, any thrush, anything like that. Again, go ahead and open up, say ah. I notice the hard and soft palate and that the uvula is midline and it does raise up when Anna says ah. Now what I'm going to have you do, Anna, is you stick out your tongue, and then I'm just going to look from side to side. Okay, good. And tongue appears to move freely, not inhibited. I don't see any impairments there. So what I'm going to have you do now, Anna, is I'm just going to initiate a gag reflex, okay? Okay, awesome. So Anna's gag reflex is intact. And so, again, no deviations from normal findings there. So I'm now going to assess cranial nerve number 11. So you're just going to shrug your shoulders, and I'm going to do it against resistance. Okay? Good. Awesome. So there was equal muscle strength on both sides. She was able to move them appropriately. And as I said previously, assessed cranial nerve 12 with cranial nerve 8. And so that concludes the cranial nerve portion of the exam. Now I'm going to move on to soft touch. And so, Anna, go ahead and roll up your sleeves for me a little bit. Awesome. So I'm going to have you just close your eyes and let me know when I'm touching you. Okay? So we've already done the face, so now we'll move on to the upper extremities. Uh-huh. All right, and then on down to the lower extremities. I'm just going to take off your sock for a second, Anna. Okay.
No. No. No.
All right, I'm going to take your other sock off.
No. 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 No.
All right, awesome. And so now what we're going to do, Anna, is again the sharp and dull. And so I'm going to start upper extremities and go down to lower extremities. Okay? So close your eyes for me and just tell me if it's sharp or dull.
Sharp. I don't know.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull.
Okay.
Sharp.
Okay. And then on down to lower extremities.
Sharp. Sharp. Dull. Dull. Sharp. I think dull. Sharp. Dull. Dull. Sharp. Sharp.
Okay. Awesome. And so Anna was able to distinguish between the sharp and dull almost 100% of the time. And so sensation is normal and intact. And so now what I'm going to do is just assess your reflexes, Anna. And so for that, you can go ahead and pull your sleeve down. You should probably be able to do this right here. All right, so first I'm going to assess your bicep reflex. Okay. Yeah. And then on this other side. Okay. And then your tricep reflex. I'm just going to go ahead and get your arm out like this. Just relax. Good. And then on the other side, just relax for me. Let me hold you. Good. And then I'm going to test your brachioradialis reflex. So right here. Good. Awesome. And now I'm going to move on to your patellar reflexes. Yep. Good. And this other side. All right, awesome. And then I'm going to move on to your Achilles reflexes back here. Awesome. Awesome. All right. So now what I'm going to do, Anna, is just have you close your eyes. And I'm going to actually, yeah, go ahead and close your eyes for me. And then I'm going to have you hold out your hands. And then I'm going to just push your thumbs up or push your thumb down. And you let me know which one it is, okay?
Okay.
So.
Up. Down. Down. Up.
Okay, awesome. Now I'm going to do it with your toe. So go ahead and tell me if it's up or down, okay?
Down. Down. Up.
Okay, awesome. And again, we could test it on both sides, but for purpose of exam, we'll just test it on one side. And it appears to be Anna could tell 100% of the time delineate between up or down. So she is able to identify appropriately. So now you can go ahead and open up your eyes, Anna, and I am just going to just test vibration sensation in your thumbs and in your toes. And so just going to put that on your thumb. Able to feel that? Just tell me when it stops. Awesome. And then on this other side.
Yeah.
Okay, awesome. Now we're going to do the toes. So just on your big toe.
No.
Okay.
No.
Okay, awesome. So, Anna is able to note the vibrations appropriately, and so, again, normal finding there. So what I'm going to do now is move on to assessing your ability to determine and distinguish a object in your hand, Anna, and identify that object appropriately. And so I'm going to have you close your eyes, and then tell me what that is in your hand.
Pair of keys.
Okay. And then what I'm going to do now, Anna, is just draw something in your hand, and I want you to tell me what it is, okay?
Can you do it again?
Uh-huh.
Like a Z or an S?
Try this one.
3.
Yep. And then I'm going to put an object in your other hand. You tell me what it is.
Coin.
Awesome. Exactly.
4.
Yep. Exactly. So that's graphphasia, and then also assessing sensation in your being able to delineate exactly what the object was and identify that appropriately. So you were able to do that well. And so now what I'm going to do is have you just touch your finger to your nose on both sides, and then yeah, so you actually hold your hand out here and you go hand to nose and back, hand to nose and back. Exactly. And then with your toes, what I'm going to have you do is actually run your ankle across your shin here. Yep. And then on the other side. Awesome. And so, again, Anna was able to do those appropriately, and so I don't see any abnormalities there. And so that concludes the neuro exam. Anna appears to be in good health. I saw normal findings throughout. I didn't see any deviations from normal that would give me any cause for concern. And that concludes the end of the exam.